Hello, everyone. Welcome back to Cowboy and the Queen of Aesthetics. And today we are going to be talking about Thulium 1927 lasers, which is super exciting because we have a couple in our practice. But before we jump into this, Wyatt, let's talk a little bit about some controversy that we've had on some of our previous podcasts.
Yeah, and so this is so great. I mean, like what you're always talking about, whether it's someone that has questions about if it's a positive or negative, that's okay. But it was in regards to peptides, and we kind of chatted about this weekend and so forth. So just I didn't know for sure if we want to just elaborate on this, but this is always great to see or and always great to hear because this is what we want. We want we want.
Absolutely. I think healthy conversations in regards to things that we disagree about or we disagree about are very healthy, especially in the aesthetics and wellness space. And so, one of the concerns this weekend was they wanted to know where we got all of the information from our podcast on peptides. So, right now, we know that in the functional medicine space, that peptides are very controversial. And so, we're waiting for that to be kind of ironed out. But I still think, Wyatt, because of what we see in our practice every day, that when I come on this podcast, I'm going to show you and tell you about my real life experiences for hundreds of patients that are on these peptides and hundreds of patients that have changed their lives. Literally, they're off more medicines than they've ever been before. They walk in looking like a different person because they feel better internally. We've helped them get off of numerous medications like cholesterol medicine, heart medication, blood pressure medications. And so I just speak from what I see in real practice. And so we can beat the street on, well, peptides have not been, formally FDA approved for this, that, and the other, and that's fine. And if someone believes that that's true, they are totally entitled to their perception and their opinion on that. But it isn't going to change mine because I will stand on all of the data and research that I know exist in this space. And I will also base what I say on this podcast on what I see in my practice every single day. And you would have to beat me down and make me think really hard to make me change my mind on the hundreds of patients that literally bounce into my office and they're like, I'm off of this medication, and I've lost 20 pounds and I have my life back. And they look differently when they
Mhm.
walk in my front door. So bring on the concerns, bring on the questions because we are ready to go toe to toe because everyone is entitled to their opinion. And I'm happy to debate why we feel like this is ours. And that's the lovely thing about medicine is that we can agree to disagree. But as long as we're practicing safe, ethical medicine and patients are getting better and there's no harm done to patients, I think this is the forefront of medicine. I'm a little woo-woo. I'll say it, right? I think lights can heal people, the right kind of lights. I believe that peptides can heal people. And I am not for taking medicine. In my household, we try to stay far away from pharmaceuticals. And now you'll hear me say the pharmaceutical cartel, more than once on this podcast. So we welcome those questions and concerns. But when someone chooses just to say, where did you get that information from? It depends on which question, because every single question that we answer on this podcast has many references. So I appreciate that. And let's just go, man. I mean, I'm ready to debate and have these conversations.
Yep, yep, and we do appreciate that as I appreciate that as well. But like, and today though, we're
Right.
talking thulium lasers and specifically the two everyone keeps talking about, NouvaDerm and Moxi, right?
Yes, yes. Because patients and honestly, providers keep asking the wrong questions, in my opinion, on these lasers.
Well, yeah, because everyone wants to know which one is better. Well.
Right. It's true. It's true. But it's which one is better for who and for what goal, right?
All right. So, all right, let's level set this. Well, let's level set this first, right? Because
Okay.
both these visors are based on a 1927, nanometer thulium technology, correct?
Right. And what that wavelength loves is to target water in the epidermis and the superficial dermis.
Yeah. So, like translation for real humans, these lasers are great for pigment, texture, early collagen stimulation.
Yes, Wyatt, that is true. So at a high level, yes, these do live in the same family because they behave clinically, because how they behave clinically is where things start to diverge.
Yeah, so I mean, let's just start with Moxie because this one has become extremely popular, in the prejuvenation space as well. And, you know,
You
Moxie
stole my word for
but yeah, I know,
rejuvenation.
I'm using all these fancy words you got teaching
Yeah.
me because 'cause you're helping me, but, like, you know, Moxie is really designed as you know, a gentle, non-ablative fractional treatment, you know, like the maintenance, fresh, and, you know, like early, intervention.
Yes. So I always tell patients, this is your keep your skin honest laser.
Exactly, and it shines for younger patients, early pigment, and people who want minimal downtime.
Right. So Moxie is great. And let's be fair, it's very predictable. It helps healing. The healing time is very smooth. It's tolerable. Tolerability is high. And it stacks beautifully with BBL and other laser treatments. So it's a very easy treatment to do. It's simple. It's 30 minutes. And so whatever you can treat in 30 minutes, you can do with Moxie. Moxie does time out. And so you have a set amount of time that you can use the tip, and then that tip is no longer good. And so you have to change the tip as a provider. So for me, sometimes I feel a little boxed in, right? Because I like to have the time availability to do multiple areas or maybe focus on one area. So Moxie's a very simple entry level thulium type treatment, especially for a provider, because it's very much plug and play and that's it.
But not and I think this is important. It's not a heavy lifter, right?
No, you're exactly right, Wyatt. So if someone has significant texture, deeper photo damage, or more advanced aging, Moxie may require multiple sessions, and that still may not be enough for the patient.
Yeah, so it's a you know, it's a great maintenance tool. It's not your full remodel, if you will.
No, it's where things get a little bit interesting with these two lasers for sure.
Well, that's you know, this is also now getting into, you know, to the NuvaDerm, you know, is often described, you know, as the next generation fractional therapy system. Um, and the key word here is customizable.
Unlike strictly gentle devices, this platform can operate across multiple intensity levels. And so that's why it is really that next level when it comes to resurfacing.
And I love it. You know, it's non-ablative, sub-ablative, more aggressive settings, and you know, it's all depending on how the provider, of course, programs it.
Absolutely. So the chefs can cook as much as they want in the kitchen and change the recipe however they choose fit or however they seem fit. And so what makes this incredibly versatile is the fact that you can change those settings, but it also makes it more operator dependent. So if you want to use this as a beginning laser tech, then you will just go with the set settings that come available on the system. But when you become a master chef, and you want to really dial those in, the beauty of NuvaDerm is it allows you to change the joules and the dwell time, and even for hair restoration, how large of an area
Mm,
we're treating at one
yeah,
time. So we
yeah.
can really dial this in and do many different things with NuvaDerm.
Yeah, but and then, like I said, where NuvaDerm stands out, you know, I tend to reach for it because there's mixed concerns, right?
Right. So if a patient comes in and they have pigment and texture and laxity, then we can treat on a pigment setting with one pass. We can go in on a wrinkle setting with one pass. We can do a texture setting on one pass, or we can focus in a little different setting for laxity and tightening. So again, in one session, as long as we need that session to be, we can change those settings and really dial those in. So we can stack energies too. So I could do a stamping setting where I'm treating pigment, and then I can stamp on top of that and treat deeper wrinkles. And then I can treat scars. And then I can lightly go over and treat the entire area or the entire face, neck, chest, really any body part with just a lighter setting for texture and tightening.
Yeah, and I love NuvaDerm too. It also fits beautifully into like your regenerative protocols, you know, where you want scalable collagen stimulation.
Absolutely. But what I like to say is with NuvaDerm, with bigger power comes greater responsibility. So settings and patient selection really matter a lot here. And so with this device, because it has more power, we just need to know and understand Fitzpatrick's and what we're trying to treat because it does not have a lot of pain involved and it's super sexy and sleek to use. But we need to remember that we do have to be very responsible when we are using these more customizable settings.
All right, so if we zoom out, then you would say,
So I guess I would say Moxie is more of a maintenance first type of treatment.
okay, so NuvaDerm is more it's flexible first. correct?
Absolutely. So neither is really better. They just live at different points on the aesthetic roadmap. So Moxie is going to be your very basic intro level Thulium 1927. And NouvaDerm is going to allow us to treat a little bit more of those deeper skin conditions and can be a little bit more aggressive with those. And also body areas because it has the ability to treat
Mhm,
larger body areas with not as much time involved in the procedure. We can treat a back in 10 to 15 minutes. We can treat arms in 5 to 10 minutes. So the versatility size of the head also differs between Nuvoderm and Moxie. Moxie has one size treatment head, and Nuvoderm has different size treatment heads. I think there's three different ones. So, and also it has a hair setting. I also like Nuvoderm when you're trying to really customize and treat maybe around the eye area because there are different shapes, which
mhm.
allows us to pick, what shape we want and what size we want that shape to be when we're trying to treat those stubborn areas that are hard to reach, like under the eyes where patients absolutely hate their texture, or
Mhm.
their upper eyelids where they hate the
Yeah.
laxity.
Yep, exactly. And then, like I said, let's make it real for the listeners here.
Okay. So I think I would say if in your 20s and 30s and you have mild pigment and you want that glow with basically no downtime,
So, I mean, Moxie's obviously, a beautiful entry point, you know?
that is exactly what I would say. Moxie would be what I would say for those patients. But if you're in your late 30s and 40s or beyond, and you're seeing more texture, tone, and those earlier structural changes in your skin, then
Yeah, I
you
mean,
might want to
yeah, you would need something with more range and it's more customized, there's that word again, see, you know?
customizable.
Yeah, exactly.
And this is exactly absolutely. This is exactly where your cookie cutter laser recommendations can get you into trouble because it's not one size fits all. And even though these are the same technologies, they're very, very different when it comes down to the customization of how we treat patients. And that really, when we can customize something, that's where outcomes become different. And that's where patient expectations and patient experiences really vary as well.
Right, and then I agree, and, how we like to go into our next segment is, of course, super important, is the biggest mistake patients make.
Well, as you know, Wyatt, the biggest mistake that patients make is shopping devices instead of shopping strategy and treatment plans for those specific patients.
Yeah, say that louder for the people in the back.
Right. So, because the right answer is never which laser is best
It's what does my skin actually need right now?
right now. Absolutely right. So, here is the takeaway.
Like I said, Moxie is an excellent refresh, and it's a maintenance tool, right?
It is. And Nuvaderm is your more customizable platform for patients who need to see more of a range of change.
Yeah, so the magic, is in matching the technology to the biology.
I love it. I love that. Matching the technology to the biology. And that's how you age intentionally and not accidentally.
Is there I always like to ask this question before we close. Is there anything else that you would just kind of like to end with or just kind of to our viewers so that way we can, get some questions here and how we could help?
No, I think both lasers are, obviously very good in your practice. I have them both in my practice. I just think that you have to know the limitations to whichever device that you choose on your skin and know that all devices are not created equally. And so there are going to be those little nuances in different devices. And I think the biggest one is if it's a beginning as a person that's just getting into the laser industry, I think Moxie is kind of dummy proof, if you will. It's plug and play. You set it and forget it, and you just go until you time out. Nuvaderm has that same capability. But in addition to that capability, it allows us as advanced laser practitioners to then go, okay, here's the canvas. What area of the canvas has the most damage and needs the most work? Pigment, okay, I'm going to use this setting. Fine lines and wrinkles, this setting. Deeper lines and wrinkles, this
Mm-hmm.
setting.
Mm-hmm.
Redness and pore size, this setting, and overall skin tightening, this setting. And so I think if we can, if we're really those more advanced aesthetic practitioners are looking for a tool that they can really dial in and customize, And I think with customization comes higher patient satisfaction.
Right, and then, of course, the hair restoration side, because like I said, that's a huge market, but like I said, that is for another time. But no, so
It
y'all,
is, but Wyatt, it works
yeah,
so
I
well.
mean, I know, it's no consumables, so I mean, it is a huge, huge area. So yeah, I've just always a pleasure, always such great information, y'all. We appreciate y'all. Um, Thank you, and we will see y'all next time.
Thanks for joining us in the Cowboys and the Queen of Aesthetics, and we'll see you next time on the next episode. Thanks for watching.